Today, I will be teaching about coronary artery disease. I chose to speak about coronary artery disease because I just found out I have an uncle that was diagnosed with this disease and I wanted to learn more information on it. So I will be going over the effects it has on our hearts, the types of symptoms that we may see, and the types of treatment that doctors may give to treat the disease, and other ways to live a healthier life when you are diagnosed with coronary artery disease. But first, we need to know how a healthy heart functions. The heart is a muscular organ that pumps blood throughout the body. Like any muscle, it needs a constant supply of oxygen and nutrients to work properly. The oxygen and nutrients that are supplied to the heart come from the coronary arteries. The coronary arteries wrap around the heart, like you can see in my image right here. Right here, I have two arteries showed, a right coronary artery and a left coronary artery. This allows for the heart to contract and to have a regular heartbeat. Now I will be speaking on what goes wrong with our heart when we have coronary artery disease. Coronary artery disease is usually caused by atherosclerosis. Atherosclerosis is the fatty buildup within our arteries. Over time, the fatty substances like cholesterol become plaque and make it harder for the oxygen blood to go through the arteries. As you can see here, you can see that it's more crowded and it makes the heart work harder because there's blockage right here. When an artery becomes blocked, some symptoms that may arise is chest pain being one of the main ones. The chest pain is known as angina. Other symptoms may be shortness of breath, fatigue, and dizziness. And in serious cases, when the artery is fully blocked, a major heart attack may occur. One thing I did learn is that depending on where the blockage happens, whether it's closer to the beginning of the artery or the little branches that are out on the that branch out of the main artery, those might become minor heart attacks and not so fatal. If one does believe that they may have coronary artery disease due to the symptoms that they may come across, they may visit their doctor and look over their medical history. And if the doctor believes that they may have CAD, then the doctor can refer them to go get blood work done. And once they get the blood work done, and if they believe further testing needs to be had, they can get an electrocardiogram done or an echocardiogram done, even a stress test, to name a few of the other tests that they can do to see the severity of coronary artery disease that they may have. Some types of treatment that can be had to treat CAD is lifestyle changes. Well, also it depends on the severity of the blockage that they may have in their arteries. But for a not so severe case, they can do simple lifestyle changes like eating healthier, working out, trying to lower their stress could be another one. That way they don't have to have their heart working so hard. In other cases, when it is a severe case, doctor may prescribe you different types of medication to lower your cholesterol, beta blockers, and other medications in that sort. In severe cases, patients may need to undergo procedures, medical procedures, and they may have to do an angioplasty. An angioplasty is when they go inside the arteries and they put a balloon in there to open up the blockage and have a stent put in. That way it opens up the artery so the blood can flow in and out smoothly. Now that we have learned what coronary artery disease is and how it is developed, we can go on and teach others to make sure that we are all making good lifestyle choices, eating healthier, reducing our stress. We can further educate our peers and make them aware of what could happen if we develop coronary artery disease.